Hi guys, welcome back to my channel. I'm Abbas Ali, a full-time practicing orthopedic surgeon, a part-time YouTuber and a faculty for orthopedics, the national level exams. Now this is a quiz over here. There is an X-ray and a few questions. Now let's look at the question here. The question says, a 13-year-old male patient came to my OPD with pain in the left hip. What is your likely diagnosis? So let's go to the X-ray now and try to identify the things here. Now this is an X-ray of your pelvis with both the hip joints, and obviously it is a child because you can see the growth plate still open. And this is your right side as it is labeled on the X-ray, and this is supposed to be your left side, and the question says left side. So patient has pain in the left hip. So this side is the pathological side and we have to talk about it. Now what do you see is the pathology over here. The first thing you notice is that the Shenton's line is broken. Now what is this Shenton's line? This is the Shenton's line that you run, and it is clearly broken and it is intact on the right side. So definitely there is a pathology of the hip. Shenton's line is broken. And what do you notice? You notice that the head of the femur, that is this part, the capital femoral epiphysis, the head of the femur seems to have slipped over the neck. So this is what we call as your slipped capital femoral epiphysis. And this is the diagnosis of this X-ray. This is the reason for pain in the left hip in this child. So my diagnosis is slipped capital femoral epiphysis of the left hip. The next question is, it is more common in which gender? This is an epidemiological question. The most commonly involved gender is male. This occurs more commonly in males than females. The third question is, it is more commonly associated with which endocrine abnormality? It is most commonly associated with hypothyroidism. Fourth question, what is the named sign seen on the X-ray? There are two named signs seen here on the X-ray. The first X-ray sign is your Trethove sign. Trethove sign. Now what is this Trethove sign? This Trethove sign, suppose you draw a line over the lateral part of the neck of the femur and you extend it proximally. The line would intersect the head of the femur. Can you see the head of the femur getting intersected by that line? Okay. So this is on the normal side. So when you draw a line over the lateral part of the neck of the femur, it intersects the head of the femur. This line is known as your Klein's line. This line is Klein's line, and normally it intersects the head of the femur. In slipped capital femoral epiphysis, if you draw the same line and continue it proximally, you will notice that it does not intersect the head of the femur. This is known as your Trethove sign. Is that clear? The second radiological finding is that the head of the femur looks like the ice cream over the ice cream cone. So this sign, according to some radiologists, is been described as ice cream slipping of cone appearance. Ice cream slipping of cone appearance. So remember, slipped capital femoral epiphysis, much more common in males than females, associated most commonly with hypothyroidism, Trethove sign, and ice cream slipping of cone appearance. I hope I have helped you with this pathology. Thank you.